Not all evidence is created equal, and understanding this hierarchy is absolutely fundamental to evaluating health claims intelligently. Yet social media has flattened everything, treating your cousin's Facebook anecdote as equivalent to a randomized controlled trial involving thousands of participants. This equivalence is dangerously wrong. Medical science has developed a rigorous hierarchy for evaluating evidence quality. At the top sit systematic reviews and meta-analyses of randomized controlled trials. These synthesize multiple high-quality studies to identify consistent patterns across different populations and settings. Below that come individual randomized controlled trials, where participants are randomly assigned to treatment or control groups, eliminating selection bias. Then we have cohort studies following groups over time, case control studies comparing people with and without outcomes, case series describing multiple similar cases, individual case reports, and finally, at the very bottom, anecdotal reports from individuals. Why does study design matter so profoundly? Because confounding variables are everywhere in medical research. People who choose to get vaccinated differ systematically from those who refuse. They tend to have better healthcare access, higher health literacy, different baseline health status. Observational studies comparing these groups can't disentangle whether outcomes differ because of the intervention or because of pre-existing differences. Randomization solves this by distributing confounding factors evenly between groups. Sample size matters enormously too. Small studies can detect large, dramatic effects but lack statistical power to identify modest but real associations or to distinguish signal from noise. Large studies involving tens or hundreds of thousands of participants can detect subtle but meaningful patterns and provide narrow confidence intervals around estimates. The OncoTarget paper that's been weaponized in vaccine misinformation illustrates this perfectly. It's classified as a scoping review, essentially a survey of existing literature, mostly comprised of case reports. Case reports sit at the bottom of the evidence hierarchy because they describe what happened to individuals without any comparison group, without controlling for confounding, without statistical analysis of whether observed outcomes exceed baseline expectations. A scoping review of case reports is therefore a compilation of the weakest evidence tier, yet it's been misrepresented as definitive proof that vaccines cause cancer. Meanwhile, multiple large epidemiological studies, cohort studies, and case control studies involving millions of participants with appropriate comparison groups have examined cancer incidence in vaccinated versus unvaccinated populations and found no association. These stronger study designs contradict the weaker evidence, which is exactly what we'd expect if the case reports represent coincidental associations rather than true causation. Here's what readers need when encountering health claims. Look for the study design. Was there a control group? How were participants selected? What's the sample size? Was it peer-reviewed, and if so, where? Has it been replicated by independent researchers? Is this finding consistent with the broader evidence base? Or is it a lone outlier contradicting numerous higher-quality studies? Red flags include claims based solely on anecdotes, cherry-picking studies that support a predetermined conclusion while ignoring contrary evidence, and conflation of exploratory preliminary research with conclusive findings. Science operates through weight of evidence, not individual dramatic studies. Until we develop better public scientific literacy around evidence evaluation, misinformation will continue exploiting people's inability to distinguish strong evidence from weak.